Eczema is a term that we use a lot in dermatology, and it's used synonymously with a rash known as atopic dermatitis. But actually, eczema is a term for just dermatitis. In children have atopic dermatitis. And what this means is that their skin is not holding moisture like other people's skin does. Our skin normally has a barrier, and if that barrier breaks down, the skin doesn't hold moisture. And what happens after that, the skin gets inflamed, irritated, turns red, and itches. But it's a very common condition in children. And some children will grow out of it very early on, and for some children it will actually persist on into their teenage years and maybe even into adulthood. And common question that we get from others, what can I do for it? What can I do to prevent it? Well, once the rash develops, sometimes you need a prescription medication for that. And we use topical steroids, and there are other medications that we use that are non-steroid formulations. But once the rash clears, you need to have a good skincare regimen for your children. And that includes moisturizing. And you want something that is non-fragranced. The general rule is non-fragrance white creams. And the most important time to moisturize your child is after you bathe them. Once the skin has been in water, it absorbs that water. And if you don't put on a moisturizer, the water evaporates and dries the skin out even more. So by applying your moisturizer, it helps to seal in that moisture into the skin.